Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look at the 2016 criteria, and this is for the primary myelofibrosis. So as per this criteria, there are two criteria, there's major and minor. So major, it involves the presence of the megakaryocyte proliferation and the atypia. Megakaryocytic proliferation and the atypia, and it is accompanied by either the reticulin or the collagen fibrosis grades 2 and 3. So not meeting to the WHO criteria for the ET-PV, BCR, ACL1, the CML, the myelodysplastic syndrome, as well as the myeloid neoplasms. The presence of the JAK2 CALR MPL mutations, or in the absence of these mutations, the presence of another clonal marker, or the absence of the reactive myelofibrosis. Now, what is the minor criteria? Minor criteria, there is a presence of at least one of the following that is confirmed in 2 consecutive determinations. That is, you have anemia. It is not attributed to the comorbid condition. Then the leukocytosis greater than or equal to 11 into 10 to the power 9 per liter. Then palpable splenomegaly, then LDH increased more than the upper limit of the reference range, and then also the leukoerythrocytosis. To learn and grow daily like this, please do subscribe.